So, the tolerance function in the QRMA device is a parameter that is used to predict prediabetes, type 1 diabetes, gestational diabetes, or type 2 diabetes. Alright, now in the orthodox setting, there are certain mediums that are used to run tests. We run what we call glycated hemoglobin A1C test. Glycated hemoglobin A1C test. Alright, and the normal range is supposed to be from 5.7 and below. Now, if the reading is between 5.7 and 6.4%, such cases are considered to be pre-diabetic condition. Then, if you run two separate diabetes tests and the A1C level is from 6.5 and above, then we can conclude that such people may be experiencing type 2 diabetes. However, there are also other forms of tests that are also run to really confirm whether the patient is diabetic or not. Take for example, for fasting blood sugar, a normal reading is supposed to be between 60 to 100 mg/dL. 60 to 100 milligram per deciliter. Okay? Then what we call 1 hour postprandial. 1 hour postprandial is supposed to be less than 200 mg/dL. 1 hour postprandial, that's 1 hour glucose test, meaning that after eating you wait for 1 hour before you run the test. A normal reading ought to be less than 200 mg/dL.
Now can you see the reason why you need to subscribe for this course? The information you can gather from this course goes beyond the operation of the quantum analyzer device. If you are a healthcare consultant or you also use the nonlinear system analyzer device, you will need the widely researched information packaged in this course. So what are you waiting for? Subscribe now. Subscribe now. Subscribe now.
Today, we are looking at another topic in the QRMA device, and the topic is obesity data analysis. Obesity data analysis. You must have heard people talk about someone being obese, and here's an opportunity for you to have an understanding of what we are talking about. When you want to check whether a person is experiencing obesity hormonally or physically, the parameters that we check are the tolerance function, lipid metabolism, brown adipose tissue function, sleep apnea, and high insulin. Right, so we'll start with the first parameter, which is tolerance function. Tolerance function. Now, when we're talking about tolerance function, it is specifically speaking of glucose tolerance, not any other thing, but glucose tolerance. We are checking the ability of the body to tolerate glucose, the ability of the body to absorb glucose from the bloodstream into the body tissues and to the brain. So, if the body has an impaired glucose tolerance, then such people are 10 to 20 times more likely to get diabetes compared to people who do not have impaired glucose tolerance. Okay, so one of the first factors, or if you want to really check in the QRMA device, a good place where you can predict whether one has diabetes, the tolerance function is also an additional avenue through which you can use to predict whether someone may be having prediabetes type 1 or type 2 diabetes or gestational diabetes. Alright, so it is all about checking the ability of the body cells to absorb glucose. The ability of the body cells to absorb glucose. Alright? Glucose intolerance is common with people who are diabetic. Glucose intolerance is common with people having diabetes. In type 1 diabetes, what happens there is that the antibodies are triggered by an autoimmune reaction to go attack the beta cells at the pancreas. The beta cells at the pancreas. And what it does is that it sees insulin that is produced by the pancreas as an enemy, as a foreign object, and so it destroys it. So as insulin is being produced, it is destroyed immediately. And this will lead to little or no supply of insulin to the body. Remember that insulin usually binds with glucose for it to be able to be absorbed into the body cells. Alright? So if there is no insulin, what happens is that the body begins to accumulate glucose in the bloodstream. Alright? And that is what leads to a condition we call hyperglycemia. That's what leads to a condition we call hyperglycemia. Usually, insulin is the gateway that opens up the body cells to receive sugar. Remember that glucose is the main source of energy for the body's functionality. So if our body cells are not absorbing glucose, then the body will not be able to utilize required energy. So insulin absorption, insulin production is very key. So in type 1 diabetes, these antibodies destroys this insulin that are being produced, thereby not allowing sufficient supply of insulin, and so there will now be an increase of blood sugar or blood glucose in the bloodstream. In the case of type 2 diabetes, what happens there is that the pancreas fails to produce sufficient insulin. It fails to produce sufficient insulin, and because there's not sufficient insulin, then the body will not be able to, the body cells and the brain will not be able to absorb glucose from the bloodstream, which now leads to hyperglycemia. So when we are talking about tolerance function, we are directly and indirectly talking about insulin tolerance. Insulin tolerance, meaning that it is common with type 2 diabetes. What happens here is that the liver cells become insulin resistant. And when they become insulin resistant, then the body cells equally becomes insulin resistant. What it means is that insulin has been produced, but the body is not sensitive to open up its cells to receive glucose because it is still not sensitive to recognize the insulin that is produced. Now, this will trigger the pancreas to produce more insulin, thinking that it is because there is not sufficient insulin that is being produced, and that will now lead to hyperglycemia because the body is not recognizing it. Insulin is like a magnet that pulls in glucose from the bloodstream. So if the magnet is not strong enough, that then the pancreas wants to produce more to make the insulin capacity strong enough to open up the cells. But yet, the body cells still do not recognize the insulin. That is what we call insulin resistance. And that will now cause what we call glucose intolerance. The body cells are not taking this glucose in, and that is what leads to glucose intolerance. And it is common with diabetic patients. Now, this also happens. You also find insulin intolerance in pregnant women who are experiencing gestational diabetes, especially in the second trimester, simply because of the kind of the hormones that the body is producing at that stage. However, shortly after delivery, it becomes history. So it's just a temporary arrangement. So the tolerance function in the QRMA device is a parameter that is used to predict prediabetes type 1 diabetes, gestational diabetes, or type 2 diabetes. All right. Now, in the orthodox setting, there are certain mediums that are used to run tests. We run what we call glycated hemoglobin A1C test. Glycated hemoglobin A1C test. All right. And the normal range is supposed to be from 5.7 and below. 5.7, that's the A1C is supposed to be 5.7 and below, what we call HbA1c. It's supposed to be 5.7% and below. All right. Now, if the reading is between 5.7 and 6.4%, such cases are considered to be pre-diabetic condition. Such cases are considered to be pre-diabetic condition. Then, if you run two separate diabetes tests and the A1C level is from 6.5 and above, then we can conclude that such people may be experiencing type 2 diabetes. Type 2 diabetes. However, there are also other forms of tests that are also run to really confirm whether the patient is diabetic or not. Take for example, for fasting blood sugar, a normal reading is supposed to be between 60 to 100 mg/dL, 60 to 100 milligram per deciliter. Okay? Then what we call 1 hour postprandial. 1 hour postprandial is supposed to be less than 200 mg/dL. 1 hour postprandial, that's 1 hour glucose test, meaning that after eating you wait for 1 hour before you run the test. A normal reading ought to be less than 200 mg/dL. Okay? Now, if you run a 2 hours postprandial, the normal reading is supposed to be less than 140 mg/dL. Now, a case where the person has an impaired result for type 1 or type 2 diabetes, a fasting blood sugar level is going to go from between 100 to 125 mg/dL. For a 1 hour postprandial, the reading will be falling between 100 to 125 mg/dL. Then, a 2 hour postprandial will be giving 140 to 200 mg/dL. 140 to 200 mg/dL. Do you get that? So, glucose tolerance is given to determine how quickly the body cells are able to absorb glucose from the bloodstream within a given period of time. That's what all these 1 hour postprandial, 2 hour postprandial blood sugar tests are being run. Okay, you want to check how long does it take for the body cells to clear off the sugar level within the bloodstream. We use that to predict whether a patient is diabetic or not, whether a patient is pre-diabetic or not. Apart from diabetes, we also use it to predict people who may be experiencing conditions like acromegaly or reactive hypoglycemia or other disorders that have to do with carbohydrate metabolism. So in summary, our lifestyle and our diets can determine whether we may be vulnerable to experience glucose intolerance or not. Now, I want us to go and look at the result analysis in the QRMA device, where I'll be explaining to you what an abnormal high result may imply, an abnormal low result may imply, and I'm going to give my recommendations. So we are looking at the obesity data analysis, and the first parameter is where we are, tolerance function, and the normal range is from 1.341 to 1.991. 1.341 to 1.991. Okay, and the result we have here is above normal mildly, which is 2.391. However, when you have a result that is above normal, mildly abnormal high, moderately abnormal high, severely abnormal high, please note that it is generally not a concern. How do I mean that? This parameter is checking for glucose tolerance, meaning that the body can, if it's higher than normal, it means that it is tolerating glucose, meaning that it is absorbing glucose well. So it is, we want the body to be able to absorb glucose into the body cells even as much and as fast as possible. So any reading that is above normal is not a concern. But when we have a reading that is mildly abnormal low, moderately abnormal low, or severely abnormal low, it is showing a case of glucose intolerance, meaning that the body cells are finding it difficult to absorb glucose into the body cells. All right, either on account of high insulin resistance, or on account of poor production of insulin. In a case of type 1 diabetes, insulin is produced but are being destroyed by an autoimmune disorder. For type 2 diabetes, it's a case whereby there is limited production of insulin, which doesn't give room for absorption of glucose. So when it is low here, it may be on account of high insulin resistance or on account of diabetes, but it is showing a low tolerance function. It is indicating that it may be a form of diabetes or the other, probably pre-diabetes, type 1 diabetes, type 2 diabetes, or gestational diabetes, or other forms of diabetes. So we can actually use a low result here to predict a case of diabetes with the QRMA device. All right, now let me give my recommendations. In order to have an optimum tolerance function, an optimum glucose tolerance function, you need to watch your glucose intake. You need to watch your glucose intake in your diet. All right, if your body is glucose intolerant, then you need to ensure that you are not taking too much of glucose related foods that will cause obesity, that will cause discomfort, that will cause absorption disorder in the body cells and to the brain. Then you should also learn to exercise regularly. You should learn to exercise regularly so that the body can burn up the fat that is being accumulated. All right, so that the body can burn up the fat that is being accumulated. All right, we'll talk more details on that under other parameters. Lastly, you should learn to, learn to lose weight. If you are fat, you will need to lose weight so that you don't become obese, and so that your body will be able to tolerate glucose. Then lastly, you take supplements like alpha lipoic acid. Alpha lipoic acid. This is a very, very powerful supplement that helps to repair beta cells in the islets of the Langerhans. Remember that inside the pancreas, you will see what we call the islet of the Langerhans, and that is where the beta cells are produced, which are used to generate, or which are used to manufacture insulin that the body needs in order to absorb glucose into the body cells. So supplements like alpha lipoic acid has been proven to be very powerful in repairing the beta cells. So people who are diabetic in nature, you need to get this supplement. It has been proven to be very powerful in repairing beta cells, especially for case of type 2 diabetes. All right.
Now can you see the reason why you need to subscribe for this course? The information you can gather from this course goes beyond the operation of the quantum analyzer device. If you are a healthcare consultant or you also use the nonlinear system analyzer device, you will need the widely researched information packaged in this course. So what are you waiting for? Subscribe now. Subscribe now. Subscribe now. So what are you waiting for? Subscribe now. Subscribe now. Subscribe now. So what are you waiting for? Subscribe now. Subscribe now. Subscribe now.